Ladies and gentlemen, welcome to Journey to Virtuous. I'm your host, Sean Pearson, and today I have with us a guest, Miss Ayana Hill. She is the owner of Healthy Heart, a new integrated healthcare clinic that has been established to really revolutionize the way that we address health equity. I want to welcome you, Ayana. Thank you for being here. So I asked you to be on the show with us today because we know not just in the season that we are in now for our country, but a long-awaited answer has been needed for addressing health disparities. And I've been privy to your journey, watching you elevate to the point of being a business owner because you wanted to be part of the solution. And so I want to ask you to start with sharing with us your why. How did you get into this journey of healthcare? But first, share with us, who is Ayana? Let's start there. Give us a picture of who sits before us.
Okay. So my name is Ayana Hill. I am a wife. I'm a mother of 3 beautiful babies. I am a nurse, and yeah, that's me.
Okay. And woman of God.
And a woman of God, yes.
Absolutely.
First.
Okay. So tell me why you got into healthcare.
I got into healthcare, I kind of always been in helping others, but specifically healthcare, I was doing the administrative part of it.
Okay.
And while I'm gifted in that, I had more of a passion, like I wanted to deal directly more with the patient.
Okay.
So I went back to school and got my nursing degree so that I can do more patient care.
Okay.
And while in doing patient care, I noticed a lot of disparities as it came to providing care for Black and brown individuals, sadly.
Okay.
And so that prompted Healthy Heart.
Okay. What did some of those disparities look like? Because I know we talk sometimes in bigger circles or in broader terms about health disparities or health inequalities and the treatment of patients based on what type of insurances they have or which hospitals they go to or what clinics they have access to. So what were some of the things that you experienced in your work as a nurse?
Just like no urgency in treating certain patients depending on like what color they are, what language they spoke, or if you wanted to treat them at all based on what insurance they had.
Wow. So you literally worked with providers that it was obvious the mistreatment and maltreatment of patients.
Yes.
That's alarming to me, but it is a very real situation for so many of the people that Zion is serving, so many of the people that we've been called to serve with the businesses that Zion has helped to launch. And so with Healthy Heart, I know that this is a work that's been in the making for about 5 years now. But talk to me about being led to do this work. What was it like, that moment where you said, I have to do something about this?
I mean, just that, like working with the patients and understanding, like some patients know, others don't know. Like you go to these places, you go to hospitals, you go to see your provider as a safe place, a person you trust. You don't know what's going on behind the scenes. So some people are led to believe that they are getting the best care and just seeing that they're not, it's kind of like the system is fooling them.
Okay.
You know?
Okay.
And so wanting to come in and educate people who look like me and even people who don't look like me, because like that's a basic thing that we should all be able to get. We all should be able to stay healthy, and if you're not healthy, you should have access to quality care no matter what background you're from, no matter what language you speak, no matter what health care coverage you have, or even if you have health care coverage or not.
Right. And so I know with Healthy Heart, there's several components to this work.
Right.
And I've watched the evolution of it. I believe you started with just primary care and then it increased to the next thing and the next thing. And so give us, if you would, a list of all the many things that Healthy Heart is addressing now and plans to address coming into 2025.
Okay, so our model kind of started out basically with just hypertension, diabetes, and other cardiac diseases, because a lot of people who have those or who suffer from those chronic conditions are uneducated about what they are and what interventions they can do to help them with that.
Okay.
Western medicine is like really pushed, and some people take medicine and don't know why and things like that. So addressing that kind of system is where we started, and it has grown to not only doing that, but being a preventative care place too. So where you can come and get preventative care, and also we're educating the community on how big physical fitness can impact your health. So also having our gym available, to have a safe space for people who don't feel comfortable working out in the big commercial
Yes.
gyms and things like
Like
that.
me, yes.
So having our gym space available, and then aesthetics too. That's more like my passion.
Okay.
I'm very passionate about the aesthetics part. So we rolled that in there. So
Okay. What's incorporated in the
in
aesthetics for those the folks that don't
aesthetics would be like chemical peels for your face, Botox, fillers, things like that.
Okay. Not something you might ordinarily see on the South Side, but
Right.
But I do know Healthy Heart is valley-wide,
Right.
and so I think that's an important element of what you're offering, meeting the patients where they are. And so I love that you all do the patient care, visiting the seniors where they live. I love that the providers are mobile. The aesthetics, I'm excited to. I don't think I'd ever use any one of the services, but I know of a number of women who do. And they don't feel like that's something that they could get being that's north or south of south of the airport, unless you go to Tempe. And so I know that you soon will have a second location. Right now, Healthy Heart is operating at the clinic site where Zion's Clinic is located, but Healthy Heart is at 1522 East Southern Avenue in South Phoenix, 85040. So any of you that want to come and experience the services, not just with Miss Ayana, but with all of the providers that are part of Healthy Heart, we welcome you to come down, and you can make an appointment here at Zion's Clinic. But I'd like for you to speak, Ayana, through the lens of a young mother making a decision to move out of corporate and into entrepreneurship to be a solution for your community. Because I think a lot of times as women, we're told we have to pick one or the other. We have to be the wife and the mother, or we have to be that strong, liberated entrepreneur. So talk to me about that.
It's difficult. It's a difficult journey. Like, I'm very hands-on, like with my kids. I homeschool. I'd love to be just home with them. And I think that is another reason why I want to be an entrepreneur, because it does give me the flexibility to be at home with my kids. But I also have to provide for them. So
Right.
Just like having to deal with both, like feeling like I need to go to work so that I can provide a certain type of life for them, but in knowing that to be an entrepreneur, it takes money to make money. When you want to do something in excellence, it doesn't just happen, right? So you have to have money to make that thing possible. So it's a fine line to walk. I try to stay balanced with that. And for me, it's not for everyone, but for me, if I ever get to a point where I feel like I'm working more than I'm giving to my family, then I just take a step back.
Okay.
Yeah. So you just have to know, right? Like, what's your priority? What do you want to do? How fast you can do it, and navigate that way, I guess.
Be realistic about it.
Yeah, and be realistic. I think I used to try to do it all, and then I had to come to realize, okay, like, this is my priority. I can't get it all done at once, and I just have to be like, okay with the journey.
Yes.
Yeah, that it's going to take.
Well, every part of what you've described in terms of who you are, you said you're a woman of God, you're a wife, you're a mother, and you're an entrepreneur. And so each one of those could be a full-time something.
It is.
It is. So where do you find your respite and your rest in wearing all of those hats?
What is that?
What is that?
What is rest?
Okay.
No, I think being at home with my kids is my rest.
Okay.
Like, that's my safe place. That's where I like to be. Not that it's not busy or doesn't require a lot. It does. But that's where I feel rested. So
Okay. And being an entrepreneur and being the homeschooling mom, how do you fit in the wife stuff?
I am honestly like still learning how to do that. I think me
Okay.
and my husband both are still learning how to do that. We're both very driven and goal oriented. And we got married really young, right? So like we're learning and we're growing like as time goes on and figuring out the order of things.
Okay.
So, figure that out first. Right. Before
That's
you
the
get married,
advice,
not
right?
later. That's the advice. Figure that out first. But it's possible, right? Like with God, putting God first and then like your spouse next, everything does kind of like fall into place like when you
Okay.
have the order right.
Okay.
And when you don't do the order right, like you feel that.
That's
You feel it real
important
bad.
advice, right? I wasn't going to ask that, but I'm thankful that you said that, because it's important to have the order correct. God first.
Right.
Our spouse, our children,
Right.
and then all of the other stuff. And for some people, they interpret that God is church. And so that's a whole nother podcast.
Yeah.
We'll talk about that later. But the relationship with
Right.
God, because I've found for me that is really the space where I get the clarity about what my priority needs to be. When I need to pull back on business and pay more attention to my husband, when I need to pay more attention to the business because it is ministry for me. The service to others is ministry. And so I'm thankful that I see your generation learning it earlier than me.
Yeah.
I was not in my 30s when I figured that out. I was in my 50s when I figured out that there needed to be a order to things that brought more harmony. It's not perfect, but it definitely makes a huge difference.
Right.
So with Healthy Heart, I want to ask you about what's next for Healthy Heart. What is the vision for this coming year? We've got changing administration within the United States. We know that there was a big push by previous administrations to do away with the Affordable Care Act, and that is for the uninsured, making space for those who are uninsured. Healthy Heart seems to be a potential answer for some of those that I define as the least of these individuals that may not be insured or that will be underinsured coming into this next 4 years. So what's next for Healthy Heart and how you'll address that particular population?
Well, I think with all the things that we want to do, we have enough service lines that will sustain us to treat whoever we want to treat, regardless of where they're from or what they have.
Okay.
Because that's what healthcare should be.
Okay.
So,
I think that's one of the other questions that I am thinking about is talk to us about the composition of your Healthy Heart team, because you say we, so we know it's not just you.
right. So I do have my primary provider is Miss Tanya Sibley, amazing nurse practitioner who's, I believe, been in the industry for about 24 years.
Okay.
And she's really passionate about the care of people, and she's really passionate about teaching me everything that she has learned so that I can grow, which is why we make such a great team.
Okay.
And then we have our behavioral health.
Okay.
Our behavioral health arm is Connecting Hands. And so just the primary care and behavioral health is where the model starts.
Okay.
Right? And then we have, of course, Zion Institute, who is what I would say is our Connecting Hands, right? Through all the agencies, connecting us all together so we can provide those services.
Okay. I am really excited for 2025. I'm excited for these last few weeks of this year because
it's been a lot.
Yeah, it's been
yeah.
an amazing year of learning, amazing year of perseverance, and I know, like I said, this has been about 5 years in the making for a Healthy Heart to be at this level. I know about some of the obstacles that you encountered. Probably 2-3 years when you spent over $100,000 for a space that you could never actually open up in. Speak a little bit about that season, because I want you to be an encouragement for some of us. We hit some hiccups and we're ready to quit. We have the idea. We know God gave it to us, but we hit a bump, and sometimes that bump can halt us in our work. But I watched you overcome in spite of that. So I'd love for you to share a little bit about that season.
It did haunt me a little bit. It's extremely discouraging. I had several investors who believed in me, who believed in my vision. And I did, we invested over $100,000 in a building and made it beautiful and did a lot of things to it. And after, I didn't get to open after that, I questioned God a lot. Is this what I'm supposed to be doing? What am I doing wrong? How could I get this far and then it not be a thing, right? Did I make this up? Am I crazy?
Right.
Type of thing, right? But so I did go back to corporate and working overnight, long shifts, being away from home, and seeing those disparities. And I just became more and more uncomfortable. And so I'm okay, I just have to go back to it, So I tried to run a lot even after that. And I was also ashamed, right? Because a lot of people believed in me and knew this was coming, right? And for it to not happen, that sucked. It sucked really bad.
Right.
So now coming into it, I think I have a different drive because I went through that, right? And so I'm less dependent on investors and people and more dependent on my faith that God called me to do this. Okay. And really, I've probably gotten farther in the past 2 or 3 months than I did in that year reconstructing that building and everything, which is crazy, but that's just how it happened.
And that was a barrier that was to no fault of your own. You'd done all the things that you needed to do right. And I think that's important. Sometimes we're called to do something. We'll do everything right. We'll follow every instruction that we were given. And then it still doesn't turn out the way we planned. And so I think it's good for the folks to hear that it doesn't always come out the way we planned. The steps are not always perfectly orchestrated, but we still have to get up. We still have to keep going. And I'm so glad that you did, because now we have Healthy Heart and we have a fitness room that I can go to, and I can not be in spandex. I can be in my sweats because I'm not ready to be in the exercise gear that everyone works, but be in an audience of people that actually welcome me, where I feel supported, I feel safe, but to know that there are care providers who truly do care about me and not just the next, $200-$300 that they can make from delivering this service to me as quickly as they can, and move on. That is important to me. So I'm excited to see what Healthy Heart does in the future for the community. So my last question for you would be, because you've been in this healthcare field and you've worked in trauma and the emergency rooms and even in private practices, and you've seen the disparities and how patients are cared for depending on, like you said, their insurances or their race and ethnicity and different things like that. What advice or what guidance would you give to a patient, an everyday person that maybe they don't have the best insurance, or maybe they don't have insurance at all, when they have to go to the doctor? What are the questions they should be asking? What are the things they should be insisting on when they show up in that provider's office?
Okay, so when you go to the emergency room or your doctor to see any healthcare provider, names, always write down the name of the person you're speaking to, from the nurse to the medical assistant to the provider. And then whatever information you get, write it down, right? And do your own research, educate yourself, ask for the pamphlets, ask if there's groups or other resources or support around whatever healthcare issue you're dealing with. But educate yourself. First and foremost, educate yourself, and also be clear about what you're feeling, the message you're trying to articulate to the provider, just so that you guys are both on the same page and getting clear care. But yeah, most importantly, educate yourself and research the provider, right? A lot of us just go to our closest provider, but you can check providers out and see, get reviews and all that, and that is important. It's really important.
Know who's providing your care.
Know who's providing your care.
Absolutely. Right. Ms. Ayana Hill, thank you.
Thank you.
I'm excited for what Healthy Heart is going to be doing in our community for this coming month and years to come. If you need an appointment with a medical provider or mental health provider. If you are a senior, if you are a young adult, especially those are the populations that I see that are being most greatly impacted by Healthy Heart. Please feel free to stop by the clinic. Healthy Heart is operating at 1522 East Southern Avenue in South Phoenix, 85040. Monday through Friday. I think the provider is in the office on Mondays and Friday afternoons. But the fitness room is open 5 days a week. So feel free to come down, learn more about the fitness classes. Actually, I believe Healthy Heart is recruiting for some instructors for fitness. Okay, for what specific classes? Share that with the audience.
We're open to like whatever classes that are like fitness. We are open to whatever. So right now we're doing step aerobics, like some Zumba. We have bikes to do spin, which is another thing I'm super passionate about.
Yes.
So anything.
Okay. So if you're interested in being an instructor at the clinic, stop by and see us. You can also give a call at 602-314-6022. That's the number for the clinic. I thank you all for spending time with us today. I thank you, Ayana, for being a guest here on Journey to Virtuous, and we will see you next time. Thank you for joining me on my podcast, Journey to Virtuous. Please like and subscribe. If you'd like to know more about the work that I'm doing, please visit me on social media at thezioninstitute.org or Whisper Consulting, or also Sean Pearson Journey Coach. You can also find me on one of my websites, thezioninstitute.org, thezioninstitute.org, or whisperconsulting.com. That's WISPHER consulting.com. Thank you for your support.